Good afternoon. So, ladies and gentlemen, good afternoon. We welcome you to this plenary 3 session, Innovative Approaches for Public Health Pathogen Genomics and Bioinformatics in Africa. Believe me, we've saved the best for last, so thank you for being here today. The session is going to be in 2 parts. We'll start with some presentations, and then after that we'll have sort of like a panel discussion. And I think we'll just move on and take the welcome remarks by Dr. Ahmed Ogwell Oma, Director of Africa CDC. Thank you very much.
Thank you very much, Teresa, and good afternoon, good evening here, and wherever colleagues are joining us from online, their timeline is respected as well. First is, let me thank those of us who have managed to join us for this very important session. And I would like to say that for us at Africa CDC, we always take every opportunity to be able to share the areas in which we are working, including the new areas in which we are going into, particularly here on the continent. As we may know, today we are living in a lifetime where we get a lot of emerging and re-emerging diseases, particularly here on the continent. We are dealing with a lot on a daily basis, even though only a few get to be reported and discussed. All diseases are coming back. New ones are joining the queue to create a lot of pressure for us in Africa, whether it is the healthcare system, it is the economic system, it is our environment, etc., etc. And all these very complex set of circumstances are coming at a time when the continent is facing many other challenges, whether they're political, security, economic, etc. Very complex situation that needs us to think a little bit differently, to act a little bit differently in response to this very complex set of challenges that we are facing when it comes to health emergencies on the continent. We have decided that in responding to all these multiple outbreaks and disease threats on the continent, we are going to seek to strengthen our health systems by using every means and every tool that is available to us. And as we respond to the current challenges, we are also preparing for the next ones. As I described in the morning, our new public health order, we really want to leverage heavily on technology so that we are able to do things more efficiently, faster, and address many more complex situations at the same time. And we want to do this in a way that captures the current challenges and also captures the emerging and re-emerging diseases that we are seeing on the continent. The reality is we can only be able to do that if our surveillance mechanism is top-notch, if it is working properly. That way we can be able to have early warning systems and pick disease threats as early as possible. And to be able to do that, we need to know what we are looking for, and when we get a challenge, we also need to characterize it properly so that we can prepare for its response in a way that limits transmission within our communities and limits damage to society, economy, and the continent as a whole. We have seen over the last maybe 5 to 10 years many new technologies coming up. These have made it easier for us to be able to identify pathogens that are creating problems in the community. And apart from identification, it has made it possible for us to be more precise in which pathogen it is. Now, these technologies and innovative tools like pathogen genomics are critical in empowering our surveillance systems on the continent and in ensuring that we can be able to do all the detection and response in a timely manner. A shift has been taking place in disease surveillance in the recent past. And from pathogen discovery and identification in humans and animals to the very wide range of screening that we can be able to do in single samples and in hotspots, all this within the milieu of many, many pathogens and many, many infectious diseases that are now becoming a threat to us as humanity. Good example of technology is at the beginning of this pandemic, when we first heard of a pneumonia-like outbreak in China. It took them a very short time, 10 to 12 days, and that particular pathogen had been characterized. This would not have been possible before when we didn't have the right tools in place. Therefore, all these new methods need to be carefully used so that they introduce efficiency into the way that we do surveillance, not just here in Africa, but globally. The empowerment of public health institutions with all these tools, including very sophisticated laboratories, is a way of ensuring that here on the continent we have the right capacity and capability when it comes to speed and precision of identifying pathogens. And that is why at Africa CDC we launched the Africa Pathogen Genomics Institute, which has come up with the Africa Pathogen Genomics Initiative, an initiative that aims at strengthening the pathogen genomics and bioinformatics capacity across the continent with tools, technologies, knowledge for our experts to be able to use them in addressing disease threats and health emergencies on the continent. Since we launched the Africa Pathogen Genomics Initiative, we have conducted the largest ever distribution of sequencing equipment, reagent supplies, and even training globally. Nobody has ever done it at the scale that we did. Nobody has ever done it at the speed that we did, and nobody ever did it during lockdown circumstances globally. It is one of those stories that one day we hope we'll be able to tell when we are slowing down in responding to all the outbreaks that we have on the continent. Message is that the Africa Pathogen Genomics Initiative has done very unprecedented work over the last 2.5 years. Now, while we're expanding pathogen genomics on the continent, we faced a lot of challenges, and we continue to face a lot of challenges. But these challenges also open up opportunities for the continent and for this area of work. One, the cost of sequencing is very high. And the opportunity here is how do we as experts innovate in a way that we can be able to develop lower cost methods for sequencing. The supply chain and the cold chain that we need for sample storage and transport is very complex and requires a little bit of refining so that we can be able to get that cold chain, we can be able to get that supply chain functioning more efficiently. I call really on our private sector. How can we be able to work together to ensure that the cold chain and the supply chain is functioning better than it is now? The data analytics infrastructure and the workforce capacity is still very limited on the continent. And although we've done a lot in trying to bring that up, the space that is left is still huge, and we hope that working together we can be able to use that as an opportunity for better capacity building on the continent. And finally, Africa is different from many parts of the world because we have communities that stay in remote areas, and they too still need our support. they too still have the very high risk of probably being the source of a particular disease threat. So how do we come up with equipment and systems that are easy to deploy in very difficult to reach communities on the continent? And not just systems for identifying the pathogens, but also for analytics right there in the community. That way we get results and we're able to act as fast as possible. In this session, we are going to have presentations that highlight the opportunities, and the panel is going to discuss really on where do we go, what they are thinking about the direction that we should take in the context of this complex pathogen genomics area of work, and in the context of the African continent with its various challenges. Finally, I would really like to thank the organizers for putting this together. Very fantastic panel here we have today, and I'm looking forward to a very good discussion. And the way forward that is going to be discussed and hopefully agreed on, we commit that as Africa CDC, we will facilitate its implementation here on the continent. So I'm really looking forward to this particular session on pathogen genomics and bioinformatics in Africa. And yeah, please, for the panelists, tell us everything. Don't keep anything and go back with it. Share as much as you can be able to share. Thank you very much.
Thank you, Dr. Ahmed, the Director of Africa CDC, for setting the stage and making my work so much easier. So I think we'll just move on to the first presentation, which is on innovative methods for public health pathogen genomics in Africa. And this will be delivered by Dr. Sophonias Tessema, who is a program lead for Pathogen Genomics, Africa CDC. Dr. Sophonias. Please, a round of applause for him.
Thank you, Dr. Teresa, for that invitation. What I will do is I will just add a little bit more on what the Director of Africa CDC, Dr. Ahmed, highlighted. What did Africa CDC do in the past 2 years to expand this technology in the continent, especially in the public health space? So my presentation will highlight public health pathogen genomics at the Africa CDC. And then I'll try to give some overview of the Africa Pathogen Genomics Initiative. This is an initiative of the Africa CDC to expand this technology in the continent and to support member states to implement and utilize genomics for public health decision making. What are the lessons that we are learning and what are the opportunities for innovation? So I'll focus on highlighting all these key issues. Just to highlight on where did we start and where are we going from here. The Africa CDC is a young organization. It's only 5 years old, and it was launched in 2017. 1 year after its launch, Africa CDC started to see what are the opportunities, what are the challenges, what are the gaps in implementing public health pathogen genomics. Because as Dr. Ahmed said, the Africa CDC would like to leverage technologies to empower public health outbreak detection, outbreak response in the continent. So from 2018, 2019, we were studying what are the gaps, where do we have the capacity, where do we lack the capacity, what are the opportunities in the continent to expand this technology. We conducted an assessment covering all the 55 countries, either through visits to the labs and then also reviewing available documents. Based on the results from this assessment, the Africa CDC responded very quickly. In November of 2019, the Africa CDC launched an Institute of Pathogen Genomics to address the gap in the continent, to respond to the findings of this assessment. 2 months later, COVID-19 was reported. So since the launch of this institute, our work has been focusing on responding to the COVID-19 pandemic. In October 2020, because of the increasing demand in the genomics space, the Africa CDC further launched an initiative called the Africa Pathogen Genomics Initiative, which addresses key challenges, key gaps in the continent to expand genomics. Since then, we've been responding to the COVID-19 outbreak, but we are also thinking beyond COVID-19. How do we utilize genomics, not only just to respond to the COVID-19, but to prepare the continent for the future outbreaks, as well as to address key health challenges such as malaria, TB, HIV, cholera, and other diseases that are endemic in the continent. So we are working on responding to the pandemic, as well as with a view of building health system, building pathogen genomics and bioinformatics ecosystem in the continent to respond to future health threats. So this is a map that I would like all of you to see. There are only 7 countries in 2018-2019 that had public health genomics capacity in their institutions. So most of African countries didn't have this capacity. This is the result of our assessment. So Africa CDC responded to this finding, because as you can see, 48 countries in the continent had no genomics capacity in their public health institutions. So what this means is public health institutions in Africa were not utilizing this technology, although this technology was very commonly utilized in the West or in the Northern Hemisphere. So in response to this finding, the finding which showed lack of capacity, lack of workforce, lack of infrastructure, the Africa CDC responded very quickly and launched an initiative that covers all the different aspects of pathogen genomics, from strengthening our capacity within the Africa CDC to strengthening the continental capacity for public health. And this is done in collaboration and partnership with several partners in the public, private, and philanthropic sectors. I think one of the strengths of this initiative is trying to bring all the different sectors together to respond to the continental needs and the findings that we had from our assessment. So what did we do in the past 2 years? In the past 2 years, we were supporting and coordinating with all our 55 member states, and we were able to coordinate the generation of data, especially in response to SARS-CoV-2 from 53 member states. We were able to support countries that didn't have local sequencing capacity through sample referral. What that means is we're moving sample from one country to the other to get it sequenced. We sequenced more than 33,000 samples through the referral process. As Dr. Ahmed said, we deployed large number of equipments in the continent to expand sequencing capacity, either to strengthen the existing capacity or to expand it to new laboratories that didn't have this capacity before. We were able to distribute more than 180,000 reagents, which is the largest ever deployment of reagents in the continent to expand sequencing to support the COVID-19 response. We've been conducting trainings in different aspects of genomics, from the sample collection to the data analysis and interpretation across the continent. We were able to cover all the 53 member states that were able to sequence SARS-CoV-2 in the training. So we were expanding training, access to workforce, access to technologies in the past 2 years. But for sustainability aspect, we are also looking into what are the policies, what are the existing mechanisms in the countries. We were able to map 41 of the 55 member states, and we are continuing to finalize that very soon. So what did this result show? So as you can see in this figure here, I think what is very striking is in 2020, all the 55 countries were only able to sequence 5,000 genomes, which is probably a 1-week output in a European lab. In 1 year later, this number actually increased by 12-fold in terms of number of sequences. We're not only interested in the number of sequences, we are also interested in expanding access to different member states. As you can see here, these are the countries that had sequences in 2020. But by 2021, almost 53 of the 55 countries had sequences. So more expansion of coverage of sequences, because this is very important to close the blind spots in the continent. And we increased the workforce significantly in the past 2 years. So the map that I showed you earlier, it's changing. It's changing from red, as you can see. It's more green. That means these countries have some level of capacity at the moment. And our target is to cover the whole continent and all 55 countries to have genomics capacity in their public health institutions. But this is not coming without a challenge. As it was highlighted earlier, We've seen several challenges. I think the challenges are, we see them as an opportunity. So what are the opportunities for innovation? As Dr. Ahmed highlighted, we are trying to build an ecosystem that covers from the specimen to the lab, from the lab to the data, and how this data can feed into public health decision making. So there are several opportunities, whether it's in logistics and shipping, whether it's in biobanking technologies, packaging specimens, dry ice, for example. We were importing dry ice from Europe to move sample from one African country to another African country. So there are a lot of opportunities in this space where new and innovative methodologies can actually help in terms of moving specimens in a cold chain. In the laboratory space, the supply chain, we faced several challenges in supply chain access to this technology because we don't have any local manufacturing or local distribution in the continent. So we were 100% dependent on others, and usually we have to wait for a longer period to get access to these sequencing reagents. So the supply chain, the logistics, as it was said, scalable, cost-effective methods that can be easy to use, easy to be deployed in the field, methods that do not require complex infrastructure. These are the kind of opportunities, I think, for further innovation. We've seen in the past 10, 20 years, genomics has expanded and the technology is improving very quickly, but we really need to make it more Africa aware in a way that is adapted to the needs of the public health institutions in Africa. Workforce development, training, institutions, I see here academic research institutions, how can we develop the workforce that is needed to utilize this technology, especially in the public health space. And there's also lots of gaps in the data, how we can use the data to inform public health decision making. How can we analyze it quickly and effectively to inform our decision making, which will be discussed by Professor Allen. So in general, there are quite a lot of opportunities. As we expand genomics in the continent, we are also seeing opportunities, challenges that we didn't think will be a challenge. For example, access to dry ice, but it is a big challenge. It was one of the inhibitory problem in moving specimens across the continent. So there are quite a lot of opportunities for innovation in the overall ecosystem. In terms of the data aspect, Professor Allen will present on that. But for now, this is what I have, and thank you so much.
Thank you so much, Dr. Sofonai, our program lead for pathogen genomics in Africa CDC. And thank you for sharing on the amazing work that you've been doing in strengthening the ecosystem of pathogenomics in Africa, and also for the opportunities that we all have to contribute in, under this work. I'd like to then invite Professor Alan Christoffels, who is the Senior Advisor Africa CDC, to give us his presentation on innovative bioinformatics and data analytics approaches. Thank you very much.
Thanks very much, and I bring you greetings from the University of the Western Cape. Just waiting for the slides to appear on the screen. And for the people at the back there, it's the same slide deck that was on before this, and I'm just going to continue with the presentation where Sophonius left off. And maybe in the interest of time, as they bring the slide deck back on, maybe I just start with the conclusion of my presentation, and that is what we're really wanting to see across the continent is that we start to bring data analytics back to the data versus actually the reverse. And I think the second point to actually take home is that we have to reimagine what does data management look like on the continent, and especially in light of that being a driver for data sharing. And it certainly looks as if I'm going to give this presentation without slides. So maybe let me just check with the fellows managing the slide. There we go. Could we just get over there? And so maybe we could shift back. Could you go back to about 5 slides. Could we move back the slide deck, please? Could we shift the slide deck or give me control of the slide deck and I can move the slide myself? In fact, in the interest of time, as they try to get our slides back again, maybe just to then continue by saying that what you've heard repeatedly, I think, today is the fact that as a continent we build resilience. And if you look at the work done in the last 2 years on mobilizing next generation sequencing capability across the continent, what I was hoping to show you as a slide is really the footprint of next generation sequencing capacity across the continent. And what you do see from that really is the distributed nature of data production across the continent. And as we're getting back into the slides, and so this is essentially my point, you see that our capability on the continent, not only is it scattered across the continent, but what you need to appreciate is that these resources have either been mobilized to national public health labs or aligned to national public health lab functions. And so if you were to extrapolate a bit further with such capability, if you were to just consider viral genomes, and by no means is this the full capacity of what we have to deal with on the continent, but just for viral genomes, within a 5-year period, you're talking at least 3 petabytes of data. And so with that kind of data production capability, what we really need to start to reimagine is the need for solutions that is local, that is certainly federated across the continent, the need for fit-for-purpose analytics that could be brought to where the data is being produced. And then I think what is critical, and has certainly been a narrative throughout this pandemic, is a need for data governance as a catalyst for data sharing. And so I wish to then hastily move on to the first point that I was trying to make, and that is bringing fit-for-purpose analytics to the data. And unfortunately, when you look at a lot of our in-house tools that we seem to adopt within our national public health labs, you have these methods or analytics or scripts that have certainly been built for something very specific within a laboratory. And the limitation of these is that it doesn't allow us to shift rapidly to respond to another disease outbreak. And so with that, we have to start to change a culture within our public health labs and in general for disease surveillance, where we start to employ the kind of computer engineering that will allow us to package our methodologies such that we could rapidly adjust to a completely new need. And this, as many of you in the room and also possibly online can appreciate, there are certainly enough approaches where one could think of packaging our tools or containerizing our tools so that we can have them modularized to the point where as we need a different algorithm, we can rapidly deploy those. And what this certainly helps is for us, when we have limited workforce technical skill in certain locations, to have a pre-packaged software that can be rapidly deployed on the ground. I think that would certainly help us to increase the pace with which we are going to respond to analyses for in excess of 130 diseases which plague us annually. And just to give you an example of this, over the last 1.5 years, the Africa CDC, in partnership with a range of folks, including local bioinformatics expertise, have developed a workbench. And essentially this workbench is taking a number of analytical tools and making those readily available for users. And what you see in the center of the slide is essentially the shopping cart feel, which people can actually try and appreciate, where you can select your choice of method, and what is running in the background is a combination of relational databases for rapid querying, but then also this graph database where you could store disparate data types, and that allows us the scale that we need to handle the type of data that is being produced. And this particular resource we provide as a web service, but not only that, we allow local installation at the site at which data is being produced. And so with this, we are probably putting out a call that as we collectively continue to build analytical tools to respond to disease outbreaks, we have to reimagine how we could best build that with the purpose of rapidly deploying that to the sites where it's needed most. And maybe then just shift to a data governance discussion. In the period October 2020 to end of 2021, we have had extensive stakeholder engagement with both public health officials on the continent as well as bioinformatics community to start asking, what does data custodianship look like on the African continent? And this has really led through a series of meetings which we can probably summarize as an ecosystem which you see on the right of your screen, a complex system of partnerships. You see in the center of that is a range of bioinformatics and analytical stakeholders. You see folks within the field. You see on the far right external partnerships. There is a space for coordination, as well as the type of regional centers which has been established by both the Africa CDC and the WHO Africa office. And so what this ecosystem allows us to do is, it certainly creates an opportunity for a range of partnerships. It allows us an opportunity to collectively start to build a data governance framework where we can start to certainly manage information that is being produced and the wealth of information that is being produced, so that we can inform the kind of public health responses which we need. And so we are certainly excited in this next phase of starting to roll out a range of partnerships where we could start to build this pan-African platform whereby which we can integrate data across a number of stakeholders, including those that is shown on this slide. And just to give that in another form, what you see here is certainly examples of data quality. There are data agreements. We've heard talks throughout this day about the need for making sure that we can do cross-border sample sharing. We see that there is certainly a component of engaging politically in trying to facilitate the kind of systems which we are trying to build. What you do see is the opportunity for startup companies, the opportunity for industry, and certainly the opportunity for us collectively bringing together both academia and public health. And I think this is probably what we are seeing throughout the globe, is the enormous amount of innovation which resides within the university ecosystem, and how that needs to be brought closer to the public health. And I think as we draw that gap and we try to reduce that gap, I think that is probably our next phase, and so that we can then start to build what I talk about, the fit-for-purpose applications, which we so desperately need. And so then, just to wrap up then, what I was really trying to point out in these few slides is that we have this need to strengthen our national public health institutes now. And even though we are thinking of the next pandemic, we currently grappling with enough. And so how do we strengthen our public health labs right now? And we can do that by ensuring that whatever we're building in terms of analytics is in fact fit for purpose for what is needed on the ground. And if we have this roadmap in place, we could certainly guide any external partner or any external collaboration that comes along to ensure that we are all aligned to a central vision, and that is of strengthening our public health system. And then lastly, data governance, which is needed within country but also across borders. And I think that as we shape this vision for a data governance framework, I think that is what we see as a catalyst for sharing data, not for publishing, but sharing data to make sure that we can analyze data in order to respond to the various disease outbreaks which we face. And so with that, I'm going to say thank you very much for your time, and I look forward to the discussion. Thanks.
Thank you, Professor Allen. I'm sure you'll agree with me that that was a very clear and well-delivered presentation, in spite of the challenges with the slide deck initially. And thank you. It's a good example of resilience, which you mentioned. And thank you. I think one of the new things that I've picked up is the fit-for-purpose analytics deployment. I've never heard of analytics being deployed, so that's a nice one. Thank you. So that brings me sort of to the end of my task as we move into the second phase of today's session. My name is Teresa Madubuko. I also work with Africa CDC, and I want to hand you over now to my colleague, Dr. Sarah Mwangi, to take over the panel discussion. Thank you very much.
So for the next part, I'm going to have the first panelists to invite them for opening remarks, and that is Ms. Lisa Slater. Ms. Lisa Slater is the head of public policy at African Genomics Program Office at Roche. Welcome, Lisa.
Thank you. Is this on? Thank you very much to the Africa CDC for the invitation to be here with you today, and also just reflecting on the remarks so far in this session. I think we have a very nice grounding on the importance of genomics for public health and, of course, disease surveillance. We are at quite an exciting and opportune moment for genomics as a whole, and reflecting back on the pandemic, I think there's two lessons in particular that come to mind when I think of the way forward for us in genomics in the private sector and with colleagues. The first is what happens when you really enable African-led institutions and researchers and scientists to ask the questions that they want to and need to in these settings. What we heard from Sophonius and Dr. Uma on the unprecedented success of the PGI is exactly this. You get world-class science, world-class surveillance, and outcomes. And I think this is a very important foundation for the continent going forward as we think about the role genomics can play in public health for pathogens and hosts more broadly. Secondly, the importance of partnerships. We've heard all today from the very opening keynotes and through the discussions even just now, that the pandemic provided us an opportunity to work together in ways that maybe we hadn't in the past. Multi-sectoral approaches, groups working very quickly with urgency, and we had good outcomes, I think, in the pandemic as a result of that. So taking together those two learnings, us at Roche, we've been thinking about what's the contribution we can and should make in the genomic space with these principles about supporting African-led institutions and the importance of collaboration. We're working on our African Genomics program, as you mentioned, really thinking about how we accelerate the work on the continent to make genomic data available openly in an equitable way for stakeholders, in particular in Africa. So looking forward to the discussion today, and thank you again for the opportunity.
very much, Dr. Lisa, for those wonderful opening remarks. And our next guest to give us the opening remarks is Mr. Jean-Pierre Horn. Jean-Pierre Horn is the Southern Africa Healthcare Business Lead at Amazon Web Services. Welcome, Jean-Pierre.
Hi there, thank you very much, and thank you for the invitation as well for the Africa CDC. Yeah, really great opportunity to address you here today. I think for any of you that don't know, Amazon Web Service is the cloud computing arm of the Amazon.com online retailer that everyone's familiar with. You know, what's really interesting, I think, that we've seen during this period, I think Dr. Nicholas Cripps said it probably best, that you know, the COVID pandemic really sort of exposed the underbelly of the ailing healthcare system that exists within South Africa. And I think it's during that ailment where we've been able to see the rise of technologies playing a proliferant role in being able to meet the pandemic in the needs that it has. I think we can all agree that technology has a fundamental role to play in being able to help improve some of those patient outcomes, and especially in the area of genomics. You know, I think where our focus has been very much trying to see how do we empower customers in being able to use cloud computing technologies to advance healthcare outcomes. I think, you know, one of those areas for us is being able to reduce the time to market. I think all of us are familiar with the traditional computing model, where if you need some compute infrastructure, you need storage infrastructure to run genome sequencing. You've essentially got to place an order for that piece of hardware, that piece of tin. You've got to wait months before it comes. You've got to set it up, you've got to configure it, and then you only have the ability to use it. I think what cloud computing represents and what we provide to customers across 160 countries is the ability to spin that infrastructure up in a matter of minutes. No longer do you have to wait months of lead time before you get access to compute power. To do the phenomenal work that you guys are doing. And I think a lot of what we've investing in the African continent is exactly that. How do we provide cloud computing infrastructure to those underserved communities and be able to essentially put that computing power in everyone's hands? And you know, as we go through the session today, I'll talk to you about some of the investments that we're making in that specific regard. Thank you.
I'll start with the far right from Dr. Sophonias. Nice presentation about the deployment, and I think as Dr. Ahmed rightly stated, it's been one of the, perhaps the biggest deployment of genomic sequencing equipment and reagents in the world, not across the continent. And maybe what I would like to hear from you is if you could reflect back on those two years of deployment of equipment and reagents. What were the major challenges in expanding access to sequencing within the continent?
Yeah, thank you, Sarah. I think one of the major challenges that we faced was access to these technologies. When I say access, it's actually timely access to this technology. Sometimes we have to wait 5 to 6 months of lead time to get these equipments and reagents deployed to the labs where it's needed to generate this data. I think that is the number one challenge. The second major challenge was the supply chain, the overall supply chain system in bringing these equipments, reagents into the continent. Sometimes we also had some challenge around regulations, registration of these products in countries where they were deployed for the first time. Because many of the countries that we work with, they didn't have this technology before, so the products has to be registered. So some regulatory challenges were also there. The other major challenge is the complexity of this technology. I think there is quite a lot of opportunity to simplify the overall NGS sequencing technology. Do we really need such a complex system? Do we really need such a huge infrastructure to utilize this technology for public health? So as it was said earlier, I think how can we make it field deployable? How can we make it a point of care tool so that data can actually be generated quickly to inform decision making? The other major challenge is the cost. Because it's complex, it's very expensive. So I think the complexity and the cost of this technology is one of the major challenges. So I would say supply chain and access, and then the complexity and cost of the technology was the major challenge that we've seen in the past 2 years.
Thank you for that. Maybe just as a follow-up to what Dr. Sophonias just told us about the issue of supply chain and costs. This one is for you, Dr. Lisa. You being in Roche as a player in the private sector, we've talked about partnerships and multi-sectorial approaches. And the question is then, how is Roche responding to these changing dynamics, needs, and innovation in the continent, for research and development, for reagents, diagnostics in the supply chain?
Sure, thank you. Let me answer that at a high level and the more specifics on the supply chain, because I know you want to talk about that. So I think at a high level, it's important to make sure we have the conversation be broad enough to think about the innovation ecosystem that we want to develop in Africa. And there are critical conversations happening, obviously, around supply chain and local manufacturing, which are absolutely essential. But we also want to ensure that things like research and development, clinical trials, and genomics more broadly are also considered and acted on now. So 5-10 years from now, we're ready for that. And when I hear Dr. Uma talk about the new public health order and the need to develop workforce capacities, when we can broaden that discussion to think in particular about clinical trials, as the previous session also discussed, that this is a huge opportunity for Africa. The researchers from Emory this morning were even talking about the huge interest in clinical trials on the continent. So I think that this is important for us to think about that more broadly and what that enables around supply chain and other things as you bring more investment and interest into the continent. But to answer the specific question about supply chain, at Roche we have a very big commitment to Africa, and as a result we even have our own warehouses here. And so we are maybe a little bit more uniquely positioned that way to think about quickly bringing medicines and diagnostics in and getting them across. But one challenge that we have that I would actually put back out to the policymakers is the non-tariff barriers as we're trying to, and Sophonias alluded to this earlier, the challenges in getting things across, borders and things is not insignificant. And so I think we could all work on that as a collective group on how do we reduce some of those, so in the healthcare and in the genomic space where we're not burdened by slowdowns, which is frankly a bit unacceptable when you're talking about patients and patient care. So I think that's really important and something that we're particularly focused on.
Thank you very much for that. So the next question goes to Professor Christophers. Next presentation really about data and analytics. And I think one of the striking things that we talked about is having this that is fit for purpose, something that can be made to be bespoke for the continent. And so my question is, what are some of the major challenges in data analytics, specifically for outbreak detections and disease surveillance?
Yeah, I think if we look at what we often see as a narrative is the fact that there is this digital revolution of the African continent. But in reality, we're actually finding still lots of people struggling with access to infrastructure, that in fact can enable the work which they do. And so if that is the case, it is actually very frustrating when there is a wealth of analytical solutions that is pushed onto the continent. And the difficulty is because much of this doesn't come with a consideration for how do we sustain this on the long term. And so for me, one of the challenges certainly has been that it is access to solutions, but also access to solutions that will allow people to be able to utilize it within their own work environment. And I think for me that is a big one. And as we start to look at the infrastructure across the continent, for me it is always, how do we facilitate the strengthening of systems such that people can in fact have the ability to do these analyses, which appear to be routine at times, but they really need to be able to do it on data that is being produced within country. And I think for me that is a big one. Yeah, I think maybe just to add to that, I think that as we've encountered this challenge, really it is the transfer of data, I think, is coming together to agree on standards. You know, we have actually spoken about this repeatedly throughout this last 2 years, the need for us to agree on certain standards so that we can each build the appropriate responses and still harness what people are doing across borders. And for me, if we can continuously have that conversation around how do we develop standards that could help this entire ecosystem from more rapidly responding to the various diseases which we encounter, I think that for me will be a big win.
Thank you. Thank you. So maybe I'd just like to pose this question to John Curran, just as a follow-up of what Alan is talking about, the infrastructure issue.
Yes.
So you sitting at the Amazon Web Services, you're responding to how are you responding to the challenge of access to data, that is the computational infrastructure within the continent?
Yes, thank you for the question. And I think, Prof. Allen probably refers to it best, is being able to provide not only access to computing, but also around the ability to create governance and interoperability of data, which is something I'll definitely touch on. But I think what is important to understand is, I think Lisa referred to the fact of private sector making investment. You know, we understand the value of partnerships and the value that private sector plays in combination with public sector and government. And only through the combination of that kind of partnership can you harness the kind of addressing of the issues that we're discussing here today. I think for us, our journey in terms of that partnership within the country, or the investment in this country, started back in 2006. When we created our Amazon Development Center down in Cape Town. And that was a significant step for us in the right direction, because that is essentially one of the 3 development centers that exist worldwide for all cloud computing services. You know, and it's those centers that develop the 200 plus web services that we've created across the market, and of which 16 of those are purpose-built healthcare solutions. So we've gone and taken an array of our traditional web services model, which is based on open APIs that can interoperate with any other existing on-premise applications and systems have. But I think what is important was those 16 purpose-built healthcare solutions. Healthcare solutions that allow organizations to address the challenges around data and system interoperability. Challenges around being able to source data from multiple line of business systems and getting that into a single data repository, such as the use of Amazon Health Lake, which is what we call that. And it's through those investments, I think, that we've involved as an organization. I think most important investment that we've made to address the issue around access to technology and for the provision of cloud services is in 2020. So essentially in April 2020, at the height of the pandemic, well, the beginning of the pandemic, should I say, we opened up what we call our Amazon or AWS Africa Infrastructure Region. And that is a cluster of hyperscale data centers that we've invested and opened up down in the Cape Town area. Those centers is essentially our stepping stone into serving the rest of Africa as a continent. That is where African countries have the ability to go and use cloud services right or literally on our doorstep, rather than having to access the other 25 regions that we have across the world. This was our first stance or first step into Africa and as an area of investment to be able to provide access to those technologies at a shorter distance than what many other countries would do. And it's essentially our service provision center, right? So through this infrastructure zone, African countries now have the ability to go and leverage off the cloud computing services that Amazon have expensive in those systems that help address data interoperability and single repository of analytical tools and data business intelligence tools. that Prof. Allen had spoken about. But I think, that is great. So even though we've gone and made an investment in terms of infrastructure, how do we really bridge that divide of access to technology? And I think this is something that was quite important for us, that over the next 3 years, Amazon Web Services have unlocked a $40 million fund to be able to promote the Global Health Equity Initiative. And this initiative is being able to give companies access to what we call promotional credits and technical advice to be able to go and address initiatives that address that sort of health disparities that exist within underserved communities. So companies today have the ability to go to our AWS site, do a search around a Global Health Equity Fund, and you have the ability to go and apply for that cloud computing power that you need in order to address the qualities that exist in our community. And that is a free fund. You get access to the wealth of technology that we have at no cost to you. And it's really aimed at addressing these inequalities that we speak about here today. So I think just to end off, what we've taken to market in terms of our customers is being able to provide that depth and that breadth of purpose-built analytical solutions. So not only do we provide the base infrastructure, what we call the plumbing, the compute, the storage, the database infrastructure, but it's very much that built-for-purpose services that Prof. Allen spoke about, very much centered around data analytics and insights. What we aim to do, and as our objective as I look after the healthcare business, is how do you derive that data-driven insights to help improve patient outcomes? How do we predict when someone's going to have a heart attack 6 months before it happens, rather than be reactive as to when the heart attack happens? And it's through these analytical services and tools that we have that we're able to expose that. For any of you that may be familiar with an organization known as CareConnect, CareConnect is a non-profit organization, and what they've amazingly done is they've taken all 8 million private medical aid patients in South Africa, and they've created a single health information exchange. So essentially, there's 6 founding partners, which are private healthcare entities, the Mediclinics, the Netcares, the Life Healthcares, if any of you are familiar with them, as well as the medical aid payers, Discovery, MedScheme, those kind of guys. They've put all their data sets together in a single health information exchange. What they're going to be doing shortly is depersonalizing that and making that data set available to organizations, right? Promoting that concept of open data, where you have the ability to then consume that data so that you can drive those data-driven insights that I speak about. And that's where we need to go as a country, as a nation, as a continent, to be able to expose these data sets, make them freely available so that genomics experts and research experts can access that data and get insights to it by enriching the data even further and getting the kind of results that's going to help address the next pandemic that we have. And that's really where the power of technology lies. So I think I'll leave it at that. I could speak for days.
Yeah, thank you. Thank you very much for that comprehensive remark. Colleagues, at this point, I would like to invite the audience for any questions or reflections to the panel. We've got 2. I'll start with the gentleman. You may just walk to the microphone and ask a question.
I thank you for the opportunity to ask my question, and want to first of all appreciate all the speakers. The concept to bring to the platform is robust and needful. Before I ask the question, I want to say, was COVID a blessing or a curse? Because it was a curse because we lost friends and loved ones, but a blessing that it hastened some techniques that we've been lagging behind to catch up with for ages, especially the technology involving genomics and bioinformatics. And now you've all given us the need to go further. In my experience, I know that the application of genomics is far beyond the health sector. We apply it in agriculture, plant and animal breeding, and it's massive. The challenge I see is building capacity, local capacity, to match up with the ever-increasing span of the field of genomics and bioinformatics. Because you talk of one pipeline today, tomorrow there is an upgrade. And you talk about a system improvement so rapid that it's difficult to catch up with. However, if we have capacity on ground that are trained with the basis, that are fluent with the techniques, they can easily help build all of this. But what is Africa CDC doing to help capacitate local indigenes? Number one. Number two, what with a pop here, you are expected to make everything open. But data sharing, sample sharing, no matter how open you tell me they are now, I beg to differ. It's difficult to work to most of this facility which actually belong to public and request data. Even if you have innovative ideas, they don't follow. How do we bridge the gap between the academia, the industry, and the public sector in ensuring that there is openness in idea sharing, data sharing, sample sharing, and then in putting that into building local capacity? If you want to train someone, I volunteer to be number one. Thank you very much.
Thank you for that. So perhaps maybe Dr. Sophonius, you might want to take the first question in terms of capacity building within the local agencies, and then Prof. Christophers, you can talk about the bridging the gap in data analytics.
Yeah, thank you so much for that important question. But I think to highlight the work of Africa CDC, it actually predates the COVID pandemic. So Africa CDC was working on the genomics space. We were trying to expand the capacity before COVID, but COVID really helped to accelerate it. So there was some acceleration of deployment of the tools, the technologies, and then also receptivity by the National Public Health Institute, because the data was needed to inform the outbreak response. In terms of local capacity building, I think the core of our approach, our strategies, is local capacity. So what we did is we have two approaches. One is regional, we established regional center of excellences. We have about 12 laboratories in the continent that are doing regional service. This regional center of excellence these are locals. They used to have some level of capacity, but through the Africa CDC, Africa PGI, we were trying to expand the existing capacity, further strengthen it. If they have a small machine, we add another bigger machine so that they can reduce the turnaround time. If they have 1-2 people, we train more so that they can respond to the outbreak. So I think this regional center of excellences, our approach is really trying to build the core competencies of these institutions. It's not only just targeted for COVID. So they should be able to respond to other disease outbreaks. They should be able to respond to AMR. They should be able to respond to other endemic diseases that we have. The second strategy is how can we expand this technology to more countries that didn't have sequencing capacity. Again, this is part of our expansion of local capacity. So we go into national public health institutes. We assess what do they have, what they don't have, what is the need. Usually we start from small because we don't want to put too much capacity quickly. So we follow a stepwise phased approach so that we can expand the capacity into more countries. So in that case, again, although our focus is trying to respond to the COVID-19 pandemic, the trainings, we have trainings in sample packaging, referral processing. We have trainings in library preparations. We have trainings in bioinformatics. These are the approach that we are taking to build the core competencies of institutions, not only just to sequence COVID-19, but to further expand the sequencing for public health. So moving forward, beyond COVID, what are we doing? I think one of the areas that we are prioritizing at the moment is to develop a curriculum that can help us to train people with core and key competencies that can allow them to use this technology irrespective of the pathogen type, whether it's an animal specimen or a human specimen or environmental specimen. If we train people on core competencies, core methodologies, I think they should be able to deploy this technology, use this technology to actually respond to disease outbreaks. So our priority is actually training more people and training them with core competencies, not just pathogen-specific methodologies. So I think with that, we'll continue to expand the local capacity. So local capacity is our primary focus. So we've been doing it at the regional level, and then also we are doing it at the national level. And we'll continue to do that until we have a critical mass of experts in the continent which can use this technology to respond to disease threats, whether they're existing ones or new pathogens.
Thank you. Lisa?
Yes, and imagine 5 or 10 years from now that you can have a network across the continent of both clinical genomics and outcomes approaches, these centers that can do this, and the capacity building and the capabilities that will exist in those places. I think that's an exciting look into the future when you think about the development of a health workforce and that capability, which is why I think it's important that we do keep that future in mind and try to work towards that in the investments that we make now.
I think the second part to your question is really around data sharing. And I think it's important to reflect on, I think the first point really is countries that have rapidly responded to COVID-19. And a good example is Genome Canada. If you start to interrogate what were some of the key components to their rapid response, and I think the one is really to summarize where they have said that their response was 20 years in the making. What does that mean for us? It means that there is no quick fix solution. We have to build our systems systematically over time. And while we have done a lot in these last 2 years to stand up a disease surveillance response, we actually do need the kind of investment and the kind of contributions at a number of levels, including governance frameworks. And so we've been going through a process at the Africa CDC to engage countries to understand their national pathogen genomics frameworks that they use to guide their response. And it is very interesting to see about a third of the countries on the continent that have formulated certainly a detailed policy framework around pathogen genomics. And so what that means for us is that we do need at some level national development of a policy framework that would be able to map the pathogen genomics and the genomics activities to the local needs. And so why is this important for data sharing? And if you look at data sharing, if you look at some of the comments that people in national public health give with the greatest challenge, one of it is the time taken from data production to getting approval to share that with the rest of the world. And that time taken is a component of having to understand what is the impact on country and also on the specific researcher or the laboratory personnel. And so as we think of data sharing, I do like some of the distinctions between data protection versus data privacy. And data protection speaks to security of the data, and that's a technical component. How do I protect the data from versus data privacy, which we can actually shape through rules. And so how do we build those rules of engagement that can in fact facilitate that? And part of our plans moving forward is to say, on the continent, our data governance framework is in fact lacking. We need countries to have the rules with which they are comfortable with sharing that specific data. And so what you are looking for in terms of data sharing is that it's not just about posting the results, because that's actually data publishing. Data sharing is for me to be able to take my data set, hand it to you, and catalyze a process where we are in fact engaging or making sense of what the data is. And so that, I think, becomes the cornerstone of data sharing. And if we do that across borders, I think that is going to actually accelerate our response. And so to me, that is really where we're heading to in this next phase. And for us to keep in mind that this is not a quick fix solution. And we need to understand whatever gains we have achieved in these last few years, we actually have to drive that further so that we start to institutionalize the various strides which we have obtained. And so, yeah, so for me, that is it. I'm glad that you've raised your hand, that you're the first to be trained. I think that collectively we need to start to build that capacity and recognize that that building of that workforce is going to be one that we're going to have to continuously replenish because we are currently in a global market. And so as we build capacity in country, we are also trying to strengthen a workforce on the continent that is going to have to respond to the kind of pressures which we're receiving from abroad.
Thank you, Professor Christopher. So I think we can take the second question.
My questions were answered, thank you.
All right, then we have the third question from Professor Jasper.
Yeah, good evening, Jasper Rees, wandering biochemist. Particularly to you, Alan, I am a little concerned I haven't heard the words Nagoya Protocol in this conversation. So, under the Convention for Biodiversity, to which pretty much every nation is now signed up, is the Nagoya Protocol, to which about half of the world's nations have now consolidated there and ratified the protocol. There's a very interesting discussion going on about the protection of digital sequence information, which doesn't just include DNA sequence, but also includes proteomics and metabolomics data as well. And that conversation hasn't reached its conclusion, which was due to be in, I think, COP16 in China, first in September, then in December, and then cancelled. But there was a meeting in Nairobi a few weeks ago, which did not achieve a conclusion in terms of Africa's position on digital sequence information, which is very much the opposite of the European Union's position on digital sequence information. But pathogen sequences are going to finish up being managed under whatever is agreed for digital sequence information management under Nagoya. And so it's really important that we are conversant with that. In South Africa, that discussion is sitting under the Department of the Environment, not under the Department of Science and Innovation. And so it's a conversation that I missed out on because I was in Botswana. That conversation is not happening good. But when I came back, I'll kill this one too now. Then we can all go for dinner. But that's my magnetic personality. But when I came back from Botswana, I got into the end of this conversation. I think it's a conversation that if you were not part of it, and your puzzled look suggests you might not have been, if you were not part of it, then this community needs to become part of that conversation with some urgency, because the decisions that are being made sound to me rather different to what you're saying. And you're going to find that you'll get overruled by a different community of practice, which has very different agendas in terms of genomic information particularly, but that will translate into other omics technologies shortly. Thoughts?
I think what we've certainly seen is that we need to be having that conversations across the whole continent, and we need regional discussions as well. And so I absolutely agree with you that as one example, the Nagoya Protocol is certainly one that we have to actually be aware of. Our role certainly in trying to build systems is to make sure that we engage national groups in order to better understand how to respond to that. And so I definitely do not have the answers to that, but I'm very well aware that national decisions taken in this space is going to have an impact. What we do need is for those conversations to happen across the continent, and I think that we are not seeing enough of. And so I think that is probably going to be what will happen as we start to have more of these discussions, is to, at some level, also support countries in having to shape those programs. Because while having that conversation at one level, in terms of the people that have to implement things, you do need that conversation to happen at the political level. And so a very nice example is the draft convention on cybersecurity, which in fact was agreed upon in 2014 by member states. And by 2018, about 9 countries have in fact ratified that. And so we do need another conversation that is going to be at a national level to start to ask, what are we doing about the policies, but also how that gets implemented. And I definitely agree with you that that is something that is going to affect us moving forward. And it's going to be another component of this work which we have to deal with.
Thank you, Professor Christophers, for that. Colleagues, I think that marks the end of the panel discussion. Thank you very much. I will invite Professor Christophers to give us the closing remarks.
Now, I made a list of stuff that we probably need to be looking at the conversation this afternoon, looking at the conversation the entire day. We've heard repeatedly about approaches and things that we've done to build resilience. But I think what we have to collectively realize is that that resilience is in fact fragile. What we have achieved in the 2 years needs to be jealously protected so that we can in fact build on that and we can build for the long term. And I think this is probably what it is that we've heard examples certainly on the stage here about the strides that we've taken continentally in order to strengthen laboratories. We've heard comments from industry partners about some of the things that they are doing. And I do want to challenge us that what we're building has to be applicable for people in Johannesburg as much as it is in Sierra Leone, Freetown. When we're starting to build systems, we have to ensure that the conversations, as Jasper has mentioned around, the Nagoya Protocol, while that is sitting within one department within a country, it is that conversation that has to certainly spark exposure and also a method for other countries to start to build the appropriate insights into how they are going to strengthen themselves. And so I think as a unit, the Africa Pathogen Genomics Initiative, this is really a call to action for all of us, you be it here inside this room or virtually, that we have to work at building the kind of partnerships that is going to let us take what we have achieved during these last 2 years, but in fact, be more imaginative in thinking beyond this. Where do we want to be in the next 5 years? So that we can certainly build the kind of systems that is really talking about decision-making that is informed by data. So that while there's an international narrative around preparing for the next pandemic, let's not fool ourselves. We are dealing with current disease outbreaks. So how do we make sure that we build that resilience and that we actually sustain it so that we can definitely deal with what is about to come next? And I think in the interest of time, I'm going to just use this opportunity then to thank all the speakers on the stage. Thank you very much for your participation, to you in the audience that have stood the test of time to see it through to the end of the day. For those that have joined us virtually, thank you very much for your participation. And I think as a unit, we certainly look forward to further opportunities in order to grow the kind of collaborations which we so desperately need. And so with that, I'm going to bring this session to a close and wish you a very good evening. Thanks very much.